Let me throw a big number out at you. 34 plus million people in this country have diabetes. They also may have issues with their feet. We want to talk more about that and save you some pain with our guest today. I'm Carol Daniel, and welcome to One on One. Our guest here to talk about diabetic neuropathy is Dr. Ramesh Gheith. So good to have you. Thank you so much.
Thanks for having me, Carol.
I told you earlier that I know nothing, and that is not true about diabetes. My mother is a diabetic. She's been a diabetic for a very long time, and so we are well aware of the need to check her feet, and if any wounds occur, to check those wounds.
Right.
So let's start with, what is diabetic neuropathy in the first place?
Well, diabetes is such a major problem in our country. We have 34 million Americans that suffer from diabetes alone. 50% of those patients will develop a complication from their diabetes. And 50% of those patients will develop painful diabetic neuropathy. And painful diabetic neuropathy is the development of a nervous system disease that develops as a result of the dysfunction of the way the body handles the sugar when it comes to the nervous system.
And so how will I know that that is happening to me? How would my mother know that it's happening to her?
You know, it's interesting because most patients who have diabetic neuropathy just suffer in silence, and they don't realize that they're suffering from a disease that we now have a breakthrough treatment for. Whereas before, they would just be given pain medications. And they know that they have diabetic neuropathy when their feet are burning, when their feet feel like they have pins and needles in them, when there's hypersensitivity in the feet, when they can't tolerate walking around their own house without shoes on or something to protect the bottom of their feet, because it's so painful that even they can't even imagine what it would be like to live without it. It's just terrible. It's awful.
You said that it even hurts to put sheets on your feet. It's that sensitive.
It becomes so sensitive, you can't touch your feet with anything. Even the bed sheets, when you go to bed at night, when you put your socks on. Oftentimes I'll see these patients come to my office, their pain is so terrible that they'll have sandals on because they can't even put on shoes in the middle of winter.
And why is it so prevalent at night?
Well, oftentimes when we go to bed, there is nothing else telling our brain to do something. For instance, during the daytime, we're very functional. We're moving around, we're putting our clothes on, we're eating, and our brain has a lot of traffic. There are a lot of signals in the brain. But at nighttime, when we're resting, all it's seeing is the painful signals from our legs. And that's why at nighttime, these patients have a difficult time sleeping, can't touch their feet, can't get restful sleep at all. It's terrible.
I have a former producer when I lived in Cape Girardeau, Missouri, who found out he was a diabetic because his vision started to go. You told me that people find out that they're diabetic because at first their feet begin to hurt.
Right. So oftentimes what happens is a patient may present to their doctor, go to a podiatrist, come to our pain management center and say, my feet are killing me. I don't know what's going on with my legs, but I can't touch my feet. They're turning different colors. They're burning 1 second, freezing another second. They feel like 1,000 bee stings in the feet. And these patients will undergo a slew of testing. And some of those tests, including the blood work, will show that they have diabetes, and they just didn't realize they had diabetes.
Tell us about this groundbreaking treatment. How does it work and who can get it?
So groundbreaking treatment is HFX, or high-frequency therapy. And high-frequency therapy is provided by doctors like myself, interventional pain management specialists, where we place a little thin wire or lead, or catheter we call it, into the spinal canal, right about in this region here, in the lower back. And we drive that little catheter into the middle part of the spine, and we turn it on, and it sends these very fine electrical impulses to the spinal cord, and it tells the spinal cord to quiet down. And the way it does that is it increases the level of the inhibition neurons, and those little nerves then tell the nervous system to quiet down. And as a result of that, the pain signals go away, and so people can start to feel their feet again, they can start to walk, they can wear their shoes, and they can stand up taller. It also helps with their back pain if they have any back pain issues. It's a really amazing therapy. Most people who have painful diabetic neuropathy, who have maximized their medical treatment, maximized their conservative therapies, physical therapy, medications for diabetes to control their blood sugars, In some cases, they've been on pain medication. And oftentimes, all these therapies just don't work.
Right.
And so they end up in our office.
This works. So who can get it, and how do they get a hold of you in order to get this groundbreaking treatment?
Well, the treatment's available at our office through our website. You can go to manageyourpainnow.com or call our office at 636-933-2243. And those patients will then be asked a few questions, and they'll be invited in for a consultation, evaluation, and of course treatment. So those particular patients are the ones that are suffering the most, and of course have failed the conservative therapies.
A few seconds. I kind of want to make you nervous and make you make this phone call. What if they do nothing?
It gets much worse.
And we
over
don't
time.
want that.
Yeah.
We do not want that. So all you have to do is reach out to him. The website again, Dr. Gheith?
It's manageyourpainnow.com.
How about that? Manageyourpainnow.com. I'll say that in a different way. Manage your pain now. Manageyourpainnow.com. Thank you so
Pleasure.
much for joining us. That's One-on-One with Carol Daniel.